You're listening to Matters of Engagement, a podcast examining issues at the intersection of health, healthcare, and society. I'm Jennifer Johannesson.
And I'm Emily Nicholas Angle.
If you're into the stuff we talk about on this podcast, you've probably heard of Patient and Family Advisory Councils, or PFACs. They've become a standard feature of healthcare organizations across Ontario. The idea is pretty straightforward. Bring patients and families into a decision-making process, and the assumption is you'll build a system that actually works for them.
But, there's a very real question about whether that's actually happening. We ask it all the time on this podcast. Especially at the provincial level, where organizations like Ontario Health have a lot of responsibility. Ontario Health was created by the Government of Ontario to, as they say, connect, coordinate, and modernize our province's healthcare system.
Today, we're bringing you a conversation that Emily had with Sangeeta Chopra-Charron.
My professional background is in financial services. The last 4 years or so, I've been volunteering for Ontario Health.
Sangeeta was a member, then co-chair, of their PFAC. She shared the chair role with Matt Anderson, who currently serves as president and CEO.
She arrived to the role with a pretty clear sense of what meaningful engagement should look like, based on her personal experience and also through a professional lens.
I have worked in large organizations doing change management and transformational change implementation, and given my marketing and product development background, I thought I could bring something to the table and apply it to Ontario Health, given that they were looking for transformational change.
I first came across Sangeeta through a LinkedIn post. We have some shared connections, and I guess the algorithm was doing its work. In her post, she explained why she decided to walk away from the PFAC. And in a bold move, she included the full text of her resignation letter, which was addressed to co-chair Matt Anderson.
At last count, the post got 14,000 views. And the comments came from across the healthcare system, from patients, caregivers, and people who had worked inside Ontario Health itself. It seems a lot of people could relate.
Yep, we've both had experience related to the ineffectiveness of these kinds of councils, and we wanted to hear more. So, Emily sat down with Sangeeta and brought back a fascinating recorded interview. We wanted to find out what led to her resignation and what, if anything, she felt she'd learned.
Oh, and I do just want to mention here that I clarified with Sangeeta that nothing we talked about was confidential, and that she'd already shared her experience and feelings with Ontario Health. We reached out to Mr. Anderson and invited him to join us. We didn't hear back as of the time of this recording.
So what you're going to hear today is Emily and me unpacking that conversation, what Sangeeta shared, and what it tells us about the state of patient engagement at the provincial level.
Okay, but first, let's read what she posted.
We'll share an excerpt of the resignation letter here and put the full text in the show notes.
Hello, Matt. I'm writing to resign as co-chair and member of the CEO Patient and Family Advisory Council. As both a patient and caregiver, I have been committed to advancing genuine partnership in care and contributing my professional expertise in transformational change. However, it has become clear that the current PFAC structure does not support authentic collaboration. Despite consistent advocacy for shared decision-making, the Council's influence, even in basic areas such as agenda setting, remains limited. As a result, the co-chair role is largely symbolic, making it difficult to fulfill with integrity. Without meaningful structural and procedural change, PFACs risk functioning as token bodies rather than true drivers of improvement, a concern shared by many members. My experiences within PFAC also reflect broader systemic challenges at Ontario Health. After 6 years, the system remains fragmented with weak accountability, limited digital integration, and inconsistent performance reporting. These issues continue to undermine confidence in Ontario Health's ability to deliver on its transformation mandate. This is a difficult but necessary decision. I remain hopeful that Ontario Health will renew its commitment to transparency, accountability, and genuine patient partnership, not only in rhetoric, but in practice. Thank you for the opportunity to serve. Sangeeta.
There's a lot in there to think about.
Mm-hmm. Both the tone of the letter and what we talked about in our conversation indicated that she didn't want any of this to be about her personally. She had actually turned down other opportunities to speak publicly because she didn't want to be the story. What she wanted was for the issues to be heard and addressed.
Right. Well, as a resident of Ontario, Sangeeta uses the healthcare system as a patient and as a caregiver, and was motivated to respond to the public invitation to engage. So even though she doesn't intend for this story to be personal, it kind of is, in the way it is for all of us who depend on this system.
Yeah, there's a few different hats she's wearing. Volunteer, professional, patient, caregiver, and member of the public. The concerns she's raising come from all of those places at once.
Okay, well, let's start from the beginning. Emily, since you were in the conversation firsthand, why don't you get us started? What did Sangeeta say about how she got involved in the first place?
Well, like a lot of people, I think it was through a posting at her father's retirement home, saying that Ontario Health is looking for patient advisors, and if you're interested and have experience with being a caregiver or a patient, then please apply.
So that's how I applied. And in all honesty, I had no idea what it was all about. So that's why it took me almost a year to really understand how the healthcare system even works. Like, it's a massive, massive organization. And given I had no background in healthcare, it was a steep learning curve.
Yeah, I bet. Was she overwhelmed?
Well, actually, I think she took it on as a welcome challenge. Her consulting background was invaluable and led her to ask a lot of questions. Now, not to ruffle feathers, but to learn how things work. And she assumed that she was on the council to contribute meaningfully, which for her meant to take a systems view.
So I asked a lot of questions, and maybe some people didn't like it, but that's how you get to understand how the system works. And that's when I realized that the system is massive, but the bureaucracy is what is causing most of the problems. And lack of accountability, lack of transparent information, limited integration, inconsistent performance reporting, all those issues that are fundamental to running a business or running any organization, and especially in the public sector. To me, you have basically a fiduciary responsibility to the public. You have more of a responsibility to be transparent, more of a responsibility to have measurements in place. But that seems to be missing.
Do you think it was a surprise to her?
Maybe in terms of the scale of the issues, but, she's no stranger to transformation. She was drawn in because of the potential for change and impact, and they used all the right language.
When I first joined, there was no clarity because it was just, we are looking at the entire system. It is going to be patient-focused. So they use all the buzzwords. Those are the things that I am very passionate about, like having proper governance, having proper representation and team building and transformational change. Based on my background and experience, I'm thinking, they're really thinking of making changes. And they are going to use the patients and the families to really design this new system.
Okay, things started to look positive. She seemed ready to use her skills to help usher in change. But I guess at some point, things shifted?
Yeah, at the start, Sangeeta noticed that her role was fairly limited. For example, she facilitated meetings and was invited to give feedback on certain things, but she had little opportunity to shape the agenda of the meeting, which she'd assumed was part of what it meant to be a co-chair and patient partner.
Oh, that sounds frustrating.
She brought it up several times and felt she never really got a straight response. And not only that, she found that her continued questions weren't always well received.
And then at one point, I think they got frustrated and said, well, it's not really the PFAC's role to be asking those questions. We are just providing input. And I said, well, that may be true, but we are also the users of the system and the owners of the system, given that we pay into the healthcare system. So technically, we should be asking those questions. If we are really trying to be patient-centered, then we should be answering those questions and being transparent and have some accountability. And it felt like more of a tokenism, that there was a tick box, that they've got a PFAC set up because that is what was mandated by Ministry of Health.
Yeah, this is such a common experience, yet every time I hear it, I can't help but feel disappointed. So, I don't know, maybe there was some good stuff that still came of it? I do think some people find that even though the particular role can be limited, there can still be positive impact. Maybe that's the case here too?
Well, from the beginning, Sangeeta thought the council was underutilized. She wanted to create a culture that invited more engagement and proposed developing educational tools and some team-building activities.
Good ideas.
But she was met with resistance by Ontario Health and told that you can't expect too much from volunteers. She thought, well, let's see, and endeavored to connect with each PFAC member by email to see if they had ideas they wanted to contribute. And so I asked her if anything came of that.
It never made any headway because all the meetings seemed to be whatever they wanted to present and then get feedback from us. But there was no loop to close that feedback because that was another gap that I had identified. I said, okay, you take the feedback, but we never really know how that feedback has been incorporated. And if it hasn't been incorporated, why it hasn't been incorporated. So to me, that's the basic 101 of getting feedback from people. You close the loop so that people know that they're being valued and their input has been valued. Otherwise, you're wasting everybody's time.
Okay, yeah, wow. Another familiar sentiment.
I know, right? Well, here's how she sums up her experience.
So Ontario Health PFACs are basically tokenism. And it is unfortunate because the PFACs are used to provide input rather than co-design, rather than having a partner role. Because if you have a partner role, you will have more say in the governance, in the design, and the implementation of it. But it's like they bring people in and that's about it. So it ends up just being for optics, not really for having any influence in decision making.
Yeah, it's pretty clear. She was dissatisfied with how things were going and publicly resigned. Was there any fallout? Did they find a replacement?
Well, this is interesting. Maybe this was the opportunity Ontario Health was waiting for because as soon as Sangeeta resigned, they disbanded the council.
Oh, okay. Plot twist.
Mm-hmm. So just to be clear, Sangeeta had had many conversations with her co-chair, Matt Anderson. This resignation may not have been a surprise to Ontario Health. During those discussions, Sangeeta had expressed some concern over the fact that not only did Ontario Health have a PFAC, so did other entities like Ontario Health at Home, which, made it hard to locate accountability.
What seems to have happened is they brought everything under one umbrella of Ontario Health, but still left all the silos as silos. So there's no integration that occurred. That's why Ontario Health at Home has its own board. Every area has its own board and nobody's accountable, it seems like.
So anyway, this was brought up by Ontario Health as one of the rationales to disband.
Matt basically dissolved the council. So the day that I sent my resignation, he sent me an email back saying that timing is interesting because I was thinking that, based on our discussions and everything else that you've brought up, that we need to rethink as to how we are using patient advisory council. So for now, I'm just not going to move forward with it. So it came to an abrupt halt.
So the rest of the council was notified of Sangeeta's resignation and even got copies of her letter.
They were disappointed because they felt that it was just an excuse to just not do anything. And that is the problem is if at a strategic level, you're not giving any guidance to anybody and you don't know what your overall strategy is, and you're passing the buck on to the different levels, that's why it's designed to fail.
Okay, here's an obvious question. Did Sangeeta have any thoughts about what good engagement actually looks like? I'm guessing you asked.
You know I did. She had a few ideas, which I think, to be fair, many organizations strive for. But you really have to have the political will to make it all happen. commitment of resources, full system integration, and people with the right skills to ensure that things stay on track.
I think that you need to have patient voices for sure, and they're a key component of it. You need to have multidisciplinary members who actually use the system, the frontline workers. Somebody sitting in the ivory tower is not the answer. And you need to have proper governance where there's shared governance of patients being part of that governance model. You need to have the resources properly allocated where patients are part of the entire process from strategy to implementation. So because the way it's structured right now is they bring people in on an ad hoc basis and then that's about it. You have to be there from start to finish, embedded into the entire system. And you then also need to have a rotational membership as well. So you're bringing in different perspectives. Not everybody is going to be like you and I, who are vocal and will speak up. So you need to make sure that participation is accessible and it's flexible.
So, what's your impression of where Sangeeta's at now? I know this episode isn't meant to be about her specifically, but I often wonder what happens to other people who become disillusioned. I mean, we started a podcast. We've talked in other episodes about how poor experiences impact more than just a single person or initiative. It can prevent someone from wanting to engage again, which is really unfortunate. So did Sangeeta talk about what's next for her and what she wants to see?
Yeah, she did actually. She's still optimistic and knows there's a better fit for her out there. In fact, she's volunteering now with Credit Valley Hospital and is impressed with their co-design approaches, their responsiveness, and their multidisciplinary collaboration. So yeah, she's taking her energies to the regional level and I think finding it quite rewarding.
I am not giving up. I still have faith because the people working in the system in the front lines are good people. They have the right intentions. That's why they get into healthcare, right? And I have a lot of respect for them. The issue is the bureaucracy and the politics of it all.
So do you think she'll ever return to provincial level healthcare engagement?
Oh, I have no idea. But, of course, the impact of the experience still lingers. I think she just wants to see the Ontario government figure itself out and serve the needs of the people who live here.
I still keep hoping that somewhere along the lines, the government and Ontario Health, the bureaucrats, would commit to actually being transparent, will be held accountable, and form a true, genuine patient partnership. Not just in rhetoric, but in practice. I just want the system to be more outcome-driven. That's all I want.
Sounds simple, but it always seems to be such a tall order.
Well, big thanks to Sangeeta Chopra-Charron for sharing her insights and experiences. You just never know when something you post may cause something to shift.
And hey, Ontario Health, we never heard back from our invitations, but the offer still stands to come chat with us.
Until next time.
Bye for now. This episode was written and produced by Jennifer Johannesson and Emily Nicholas Engel. For a full transcript and for more information, visit mattersofengagement.com.